I'm Greg Konechny and I consent to this video.
Okay. Hi, my name is Kendra and I'm going to be your student nurse today. I'm going to start by identifying my patient using two identifiers. Can I get your name and date of birth?
Greg Konechny, 05-23-01.
Okay, perfect. Today we are going to be doing a head-to-toe assessment. Is that okay with you?
Yeah.
Okay. And then I'm going to start by performing hand hygiene, and then I am ready to start my assessment. So I'm going to start with my patient's general appearance. He is relaxed, he's comfortable, his height and weight are proportionate. He has, it appears that he has adequate nutrition and hygiene. It looks like he's in his pajamas still. I think he just woke up today, is that correct?
Yep.
Okay. And then Greg, I just have some questions for you here. Where are we at today?
My house.
Okay, and what are we doing?
Taking a test.
Okay, and what month is it?
November.
Okay, so my patient is alert and oriented ×3. His speech is clear and concise. All right, and how are you feeling today?
I'm feeling good.
Okay, so the patient's facial expression also demonstrates to me that he is content. His face looks relaxed, it's neutral, he has a slight smile to his face. Are you in any pain?
No, ma'am.
Okay, and on a scale of 0 being no pain at all to 10 being the worst pain of your life, what would you rate your pain?
0, ma'am.
Okay, good. All right, so now we can move on. I'm going to start getting your pulse, if that's okay.
Yeah.
Okay. Okay, so my patient's pulse is regular, so I'm going to count for 30 seconds and then multiply ×2. On the rest, yep, there we go. Okay. Okay, perfect. So my patient's pulse was 2+. The pulse rate was 64 beats per minute, which falls within the normal range of 60 to 100. His pulse was a regular rhythm, like I stated before. And I also tested his respirations when his arm was up on his chest. He had 12 respirations per minute. I got that by counting his respirations for 15 seconds and then multiplying ×4. And the 12 falls within the normal range of 8 to 16 respirations per minute. His depth of his breathing was about 1 to 2 inches. His breathing was non-labored. So the rhythm of his respirations was great. All right, Greg, now we're going to get your blood pressure. Do you have a fistula or anything in your left arm that would prohibit us from taking your blood pressure in your left arm?
No, ma'am.
Okay. Okay. So my cuff fits my patient appropriately by the 40 to 80 rule. And what is your normal blood pressure, Greg?
110/70.
Okay. was 108 over 72. Normal, both cephalic and, or normal both systolic and diastolic. The normal systolic range is anywhere from 90 to 120. The normal diastolic range is anywhere from 60 to 80. So both of his values fell within those ranges. All right, now we're going to start with his head here. So his head is midline with his body. His head is oval in shape. His head is a proportionate size with the rest of his body, so I would say normal cephalic. His eyes are equal here. His nose is midline and symmetric. And then Greg, give me a soft smile. Okay, perfect. So his smile is also symmetric. All right, Greg, I'm just gonna shine a light in your eyes here. So I'm gonna have you look straight ahead for me the whole time, okay? Okay, now I'm gonna have you put your hand on your nose. Perfect. Keep it right in the middle there. And look straight ahead. Okay, perfect. Now follow the, you can put your hand down, now follow the tip of my light with your eyes. Okay, perfect. Now take your two thumbs and pull your bottom eyelids down. Good. Now look over to the right and then over to the left. Okay, perfect. So when I was shining the light in his eyes, I was testing the reactivity of his pupils. So his pupils, when the light was shown in them, they constricted both directly and indirectly, which is a normal finding. And then when I had him look at the tip of my pen light, his pupils converged, which is also a normal finding. All right, Greg, I'm just going to look at the size of your pupils here. So his pupils are about 4 millimeters and they are round, which is also a normal finding. His conjunctiva is clear and his sclera is about a white to creamish color. All normal findings. All right, Greg. Now we are going to have you, I'll have you take your shirt off for me. Would you like a blanket?
I'm okay.
And then you can have a seat. Oh, you can have a seat, yep. All right. So my patient, oh, it's not, yeah, there we go. Okay. So my patient's arm is proportionate in size to the rest of his body. His skin coloration is consistent with the rest of his body, beige with a pink undertone. He does have some primary lesions scattered about his arm. Do you have any tenderness in your arm today? Okay,
No,
any pain anywhere?
No,
Any numbness or tingling down the arm and into your fingers?
Nope.
Okay. I'm going to palpate the arm, paying special attention to the joints. Let me know if there is any tenderness when I'm palpating. There is no erythema. There is no deformities to the arm. There are no masses from when I palpated. And I'm going to check for capillary refill. Good. Coloration returns in 2 seconds, which is a normal finding. I'm going to check the temperature here. Perfect. The tips of his fingers were a little cooler than the rest of his arm, but that is a normal finding, and the rest of his arm was a normal temperature. All right, I'm going to test for edema. And I already got the radial pulse, so we know his pulse is great. It was 2 plus. Okay, on a scale of 0 to 4, he scored a 0 for edema, so there is no edema present in the arm. All right, well that should be all for our arm here. And then the hair distribution along the arm is even. All right, well I'm gonna have you turn around and sit with your face again, yep. So I'm gonna listen to the lung sounds both posteriorly, anteriorly on the patient. On the posterior side here, we're gonna be listening to the bronchovesicular sounds along the sides of the spine in between the scapula. And then the vesicular sounds are going to be in the outer lung fields. The patient's scapula appear and feel to be equal bilaterally. They are normal and proportionate with his body. His ribs are sloping downward at a 45-degree angle. His chest does not appear barrel. And his AP to transverse ratio is about a 1:2. All right, Greg, I'm gonna listen to your lung sounds now. Each time I move my stethoscope, I just need you to give me a big, deep breath, okay?
Yes, ma'am.
And sit up nice and tall for me. So he does have some primary lesions on his back here. Other than that, the coloration of his posterior side is consistent with the rest of his body, beige with the pink undertone. Okay, Greg, I'm gonna have you turn around now. We're gonna listen to his interior chest sounds, or his interior lung sounds. On the interior side, we're gonna be listening to the bronchial sounds along the trachea, the bronchovesicular sounds along the sides of the sternum in between the breastplates, and the vesicular sounds and the rest of the lung fields down here. On his interior chest, the skin coloration is consistent with the rest of his body. He does have some primary lesions. He does have a tattoo here in the corner. Okay, and then I'm gonna start up above the clavicle. Move those arms just a little bit for me. Okay, good. His lung sounds were clear bilaterally on the anterior and posterior sides. I'm going to have you leave that off for just a second. There were no wheezing or crackles in his lung sounds, so everything in his lung sounds was normal. All right, now we are going to take a listen to your heart. Are you having any chest pain today, Greg?
No.
Okay. So for his chest, there is a slight pulsation that you can see on the left side here. You can palpate his pulse there. It's strong, it's 2+. Okay, I'm gonna start at the aortic, which is second intercostal space, right sternal border. I'm going to move to pulmonic, which is second intercostal space, left sternal border. Moving on to Erb's point, which is third intercostal space, left sternal border. And then tricuspid, which is fourth or fifth intercostal space, left sternal border. And then the mitral midclavicular line, which is fifth intercostal space. Good. Okay, his heart sounds were strong. They were of regular rhythm, which is all a normal finding. All right, Greg, now I'm gonna have you lay down flat for me. Yep, you can put your shirt back on. Would you like a blanket?
I'm okay.
So for the abdomen, I'm gonna make sure that his chest is comfortable and covered. I'm gonna expose his abdomen here. So his abdomen appears flat, there's no distension. His abdomen is symmetric and the skin color is consistent with the rest of the body. It is beige with a pink undertone. There are some primary lesions on his abdomen, and then his hair distribution is good hair distribution, and his umbilicus is minimal. I'm going to auscultate before I palpate on the abdomen. I'm going to auscultate in 2 different places in each quadrant. And then, Greg, are you having any abdomen pain today?
No.
Okay, since he's not having any pain, I'm going to start in the right lower quadrant. If he was having pain, I would start in the quadrant right to that of the one having pain and then move in a clockwise manner. Bowel sounds were active, about 5 to 30 soft gurgles and I would say clicks per minute. And then I'm going to palpate using 2 fingers gently in each quadrant, starting again in the right lower quadrant and moving clockwise. Okay. So his abdomen is soft to touch, which is a normal finding. We do not want to palpate anything that is hard. So his abdomen is great. Everything is looking great, Greg.
Awesome.
All right, and then we are gonna finish up with your leg here, okay?
Okay.
I'm gonna have you pull your pant leg up as much as you can. We're gonna take off your shoe and sock. Okay, so first I'm going to start by getting the temperature of his leg. Sorry, my hand. Okay, so the temperature of his hand is normal. His toes were a little bit colder, but that is a normal finding. Greg, are you having any numbness or tingling in your leg? Any tenderness?
No, ma'am.
Any pain?
No, ma'am.
Okay. So his leg does appear to be proportionate with his body. His skin coloration is consistent as well, beige with a pink undertone. His hair distribution is even. He does have a primary lesion here. I think that's the only one on this leg. His skin around his heel appears to be intact. There is no redness or any signs of skin breakdown. Same with his toes. All right, and then I'm just gonna palpate here, paying special attention to the joints. Let me know if there's any tenderness along the way. There are no erythema or deformities to the leg, foot, or toes. Okay, any tenderness with any of that?
No, ma'am.
Okay, then I'm gonna palpate for edema.
I'm sorry.
Whoa. Okay, on a scale of 0 to 4, his edema was a 0. So there is no edema present. And then I'm just gonna check his popliteal pulse. Okay, pulse rhythm is normal, it's consistent. I would say probably about a +1. Okay, pulse here is also consistent. Rhythm is normal. Probably also about a +1. So my patient has no interventions. He's on room air. There's no Foley catheter or IV. And then before I leave today, I'm just going to make sure that my patient is in a comfortable position. If we were in a hospital setting, I would make sure that the bed is in the low position, the patient has the call light in reach, And then the patient has all the questions answered for the day. I would report my assessment in the EMR. And then I would report any abnormal findings, if there were any, to the physician.